when it comes to like really tough conditions, depression, PTSD, finding new treatments, better treatments, one thing that keeps popping up,
right,
and for good reason, is ketamine-assisted psychotherapy, or KAP.
Yeah, that's right. If you're listening and you're someone who's maybe looking for some more effective solutions, especially if you've tried traditional treatments and they just haven't quite worked the way you hoped, then KAP is really interesting.
Yeah.
A really rapidly evolving area.
For sure. And I think that's why we wanted to do this deep dive today, because there's a real critical need for these improved therapies, especially for what we call treatment-resistant mood disorders.
Yeah.
So we have some great information for you today. We're going to really unpack the science behind ketamine, explore how it can work so much faster than normal antidepressants, and then also, really importantly, we're going to look at how those effects can actually last.
Exactly.
So the two main sources we have for this deep dive. One is a huge study looking at how KAP works in the real world.
And then the other is a really detailed analysis of how ketamine affects PTSD specifically. Okay, so let's unpack this a little bit.
So before we just dive right into KAP, it's probably helpful to kind of understand ketamine's history. And how our understanding of it has changed. So historically, ketamine has been used as like a very important anesthetic. And Yale Medicine points this out.
Most people think of it as like hospital surgery.
Not really mental health treatment.
Not mental health.
Not really a mental health thing.
So what sparked that change?
Well, back in the 1990s, researchers at Yale, they kind of stumbled across something really unexpected.
Oh, really?
Even at doses way lower than what you'd use for anesthesia, ketamine seemed to have pretty strong antidepressant effects.
Interesting.
And this was kind of a big deal. Because it really challenged what we call the serotonin hypothesis of depression, which had been around for a long time.
That depression is basically caused by low serotonin in the brain. Exactly. And that idea was really important, it led to SSRIs and things like that. But what Yale's research started to show was that another neurotransmitter called glutamate was also playing a key role.
Glutamate, that's not one you hear as much about, I feel like.
No, it's not as commonly discussed as serotonin when you're talking about depression. But it's actually the most abundant excitatory neurotransmitter in our brains.
Oh, wow.
And it's vital for how our neurons talk to each other.
Okay, so how does that tie into depression then?
Well, what Yale found was that major stress can really mess with glutamate signaling.
Oh, okay.
It basically makes the brain's neurons less flexible, less able to make new connections.
So like chronic stress kind of makes your brain stiff? In a way?
Kind of, yeah. And here's where it gets really interesting. Ketamine works differently from traditional antidepressants. It boosts glutamate production. Which then leads to new connections forming in the brain. And this increased what we call neuroplasticity, which is basically the brain's ability to, kind of rewire itself. Is not something you typically see with your standard SSRIs.
Wow.
So think of it like ketamine might be helping the brain to kind of reset and create new pathways.
So instead of just changing the chemicals that are there, it's actually rewiring.
That's the exciting potential,
That's really fascinating. So now let's talk about how this actually ties into psychotherapy. So KAP, ketamine-assisted psychotherapy. It's kind of taking that biological action and combining it with talk therapy.
Exactly. And, this approach actually draws some inspiration from earlier research with other psychedelic substances. The idea is to create the right conditions to promote deep introspection and those aha moments in therapy.
I see. So it's not just about the drug, it's the therapy that leads to those lasting benefits. And Yermis, their study was really big.
Oh, yeah. Huge.
For a ton of people.
It was a massive retrospective study. They looked at data from over 1,800 adults across 11 different clinics in North America. And what's really important is these were all people who hadn't gotten better with previous treatments for things like depression, anxiety, PTSD.
So like really treatment resistant.
Yeah, exactly.
So what did the KAP treatment actually look like for these people?
So they got between 4 and 6 guided ketamine sessions. The ketamine was given either through an injection or as a lozenge under the tongue. And critically, these ketamine sessions were integrated with psychotherapy.
How so?
So there were therapy sessions, usually after the first 2 ketamine doses, and then after every 2 doses after that. So on average, people were getting about 4 ketamine doses and 3 psychotherapy sessions.
So really combining those two things.
Exactly.
And what were the researchers mainly looking at? Like, what were their main outcomes?
So the main thing they were looking at was how much did people's depression, anxiety, and PTSD symptoms change after 3 months compared to where they started. And they used some really well-established scales to measure this. They used the PHQ-9 for depression, the G87 for anxiety, and the PCL6 for PTSD.
Gotcha. And I know they also looked at changes at 1 month and 6 months, right?
Yeah, sort of secondary measures, yeah.
So what did this big study actually show? Like, did KAP actually work?
The results were pretty amazing.
Oh, great.
At 3 months, they saw what we call large effect sizes.
Okay.
Which basically means statistically significant and clinically meaningful reductions in symptoms across all 3 conditions: depression, anxiety, and PTSD.
So not just like a small change, it was a big change.
Yeah, these weren't minor improvements. We're talking effect sizes between 0.75 and 0.86.
Wow.
Which are considered strong effects.
Yeah.
Substantial impact on symptoms.
So what about longer term? Did these benefits actually stick around?
That's the encouraging part. Yes, they did.
Great.
The effect sizes were a bit smaller at 6 months. But they were still in the medium to large range.
Okay.
Somewhere between 0.61 and 0.73.
Wow, that's pretty good.
And that suggests that the positive effects of KAP lasted for a while after treatment.
And I think what's really cool about that is it kind of hints that maybe the neuroplastic changes from the ketamine, and then those changes being reinforced by the therapy.
Right.
Maybe they actually do have this lasting effect on how the brain works.
Yeah, absolutely. Like these changes might actually stick around.
Right. That's amazing. So it wasn't just like the average scores going down.
Right.
But how many people actually no longer met the criteria?
Yes, that's a great point.
For these conditions.
Yeah, so the study actually found really significant what we call case reductions.
Okay.
At 3 months, the number of people who still met the criteria for depression went down by 39%. Anxiety went down by 41%, and PTSD by 39%.
Wow, so almost half.
I know. And even at 6 months, these reductions were still really substantial. They ranged from 29% to 37%.
That's great. So even after 6 months, a good chunk of people are no longer meeting the criteria.
Yeah, exactly.
So beyond just the numbers, did people actually feel better? Like, did they notice a difference in their lives?
Absolutely. At 3 months, a huge percentage of participants, between 50% and 75%, reported what's called a minimal, clinically important difference. Basically, a level of improvement you would actually notice in your daily life.
Oh, okay. So like a real noticeable difference.
Yeah, and at 6 months, those numbers were still high. 48% to 70% were still reporting that level of improvement.
Wow, that's really amazing. And I think the study even pointed out how long these benefits lasted.
Yes.
After the ketamine sessions were done.
They did. They observed that symptom improvement continued even after those 4 to 6 ketamine sessions.
Right.
In some cases, up to 5 months after their last session. Yeah. And they also found this interesting association.
Okay.
Each ketamine dose seemed to be linked to about a 1-point reduction on each of those symptom scales we talked about.
Oh, interesting. So if you get another dose, your score might go down by 1 point.
Yeah, that's what they found.
Wow, that's really cool. So basically, this huge study is saying that KAP has a lot of potential for people struggling with these conditions, especially since they're often so hard to treat.
Yeah, the researchers concluded that these findings really do support considering KAP as a viable treatment option.
Yeah.
Especially with all the mental health challenges people are facing.
Right.
And the urgent need for new treatments that actually work for these conditions.
Yeah.
Especially when standard treatments have failed.
For sure. Okay, so that gives us a really good overview of how effective KAP can be overall.
Yeah.
Now, I want to hone in on PTSD and that Macedo review. Because we know that traditional treatments, things like SSRIs and SNRIs, they often don't fully address PTSD symptoms.
Yeah, that's a really important point. And the Macedo review actually talks about what they call a PTSD pharmacotherapeutic crisis.
Oh, wow.
Which highlights how often people don't get complete relief from their symptoms.
Right.
With those traditional medications.
And earlier we briefly touched on how PTSD can affect the brain.
Yeah.
Can you remind us what the key areas are?
Of course. So PTSD is associated with changes in brain regions like the amygdala, which is super involved in processing emotions, especially fear.
Right.
And also the ventromedial prefrontal cortex, which plays a huge role in regulating our emotional responses.
Gotcha. So both of those are pretty key areas.
Yeah. And these changes are linked to shifts in lots of different neurochemical systems.
Right. So how does ketamine's effect on glutamate specifically come into play here?
Well, the review talks about how trauma and chronic stress, they can lead to the glutamate system being way too active.
Okay.
A phenomenon called excitotoxicity.
Okay.
This excessive glutamate activity can actually contribute to structural changes in brain areas, like the hippocampus.
Oh, wow.
Which is essential for memory.
Right.
So ketamine, by acting as what we call an antagonist at the NMDA receptor, which is a specific type of glutamate receptor, might actually help counteract this glutamate-related excitotoxicity.
So it's kind of like calming down that overstimulated stress response?
Exactly. At least that's the hypothesis.
And they actually looked at this in the Maseta review, right?
Yes. The meta-analysis in the Maseta review looked at several studies that investigated ketamine's effect on PTSD symptoms.
And what did they find?
Well, the meta-analysis showed that ketamine did have a significant positive effect on PTSD symptoms.
Okay.
And this was especially apparent within the first 24 hours after administration.
Wow. So really quickly.
It seemed to work really fast, yeah.
And they used a few different scales to measure PTSD symptoms in the studies they reviewed, right?
Yeah, things like the KEPI-5, the MEDRS, and the PCL-5.
Right, and that might be why the results were a bit mixed, right?
Yeah, you're right.
Some studies showed stronger effects than others.
Exactly. So the way they were measuring things and also the different designs of the studies could have led to variations in the results.
Right, okay, I see. But even with those variations, the overall trend was still that ketamine was helpful.
Yeah, exactly. Even with those differences, the general trend across the meta-analysis was in line with other research.
Okay.
Suggesting that ketamine leads to pretty big reductions in PTSD severity.
Yeah.
Especially compared to control groups.
So both the big KAP study and the review focusing on PTSD are pointing to ketamine as a really promising treatment.
It really seems like it has potential.
Yeah. So let's talk about some practical stuff now and where the research is going. So we know esketamine, which is a form of ketamine, is FDA approved.
That's right. Esketamine is what we call the S enantiomer of ketamine.
Okay.
And it's more potent, meaning you need a lower dose for it to be effective.
Really?
It's given as a nasal spray.
Yeah.
And the FDA has approved it for treatment-resistant depression.
Right.
But it's really important to understand that right now it has to be used along with an oral antidepressant.
Okay.
And it has to be done under the supervision of a doctor.
Okay, so it's not something you can just do at home.
No, definitely not. It has to be done in a certified treatment center.
Okay, that makes sense.
Yeah.
And Yale Medicine also talked about some possible side effects.
Yeah, right. So common side effects can include dizziness, feelings of detachment or dissociation.
Okay, those sound kind of intense.
Yeah, they can be a bit strange, but they're usually temporary.
Oh.
Usually happen around the time the medication is given.
Okay.
And then they go away pretty quickly.
That's good. So it sounds like the research that's being done now is really focused on figuring out how to use ketamine's potential in the safest and most effective way.
Exactly.
There's that ketamine-enhanced prolonged exposure therapy for veterans with PTSD.
Oh, yes. That's a super interesting area.
Yeah.
And a lot of research is happening there. So prolonged exposure therapy is a leading therapy for PTSD that focuses on trauma.
Okay.
But the problem is a lot of people don't fully recover with just this approach. So researchers are now looking at whether ketamine, because of its potential to enhance neuroplasticity and its influence on how we process fear, can actually make prolonged exposure therapy even better.
Oh, so it's like a boost.
Exactly.
So they give ketamine before or during those therapy sessions?
There's this study, the Sharoma study.
Okay.
It's a randomized controlled trial where they're comparing prolonged exposure therapy with and without ketamine.
Okay.
So one group gets ketamine along with the therapy, the other group gets a placebo, which in this case is midazolam, a sedative.
Gotcha. So what they're thinking is that the ketamine might make it easier to recall what we call extinction learning.
Exactly.
Which is basically learning that things that used to be scary aren't scary anymore.
Yes, and it might even help reduce the chances of those fear responses coming back.
Oh, wow.
So the idea is, if the brain is more adaptable, it might be better at processing and really taking in the work that's happening in prolonged exposure therapy.
So the ketamine makes the therapy more effective.
That's the hope, yeah.
That's really cool. What are they hoping to learn from this study?
Well, the main goal is to see if adding ketamine to prolonged exposure therapy actually leads to bigger and longer lasting reductions in PTSD symptoms, specifically in veterans. And they also want to figure out which people benefit the most from this combo, as well as making sure it's safe and well tolerated.
Of course.
So it's all about refining the approach and making sure it's actually beneficial.
Yeah. It really shows how dynamic this whole field is.
It really is.
Constantly trying to improve
evolving
how we can help people struggling with these conditions.
Exactly.
So wrapping it all up,
yeah.
What are the key takeaways?
Okay, so first off, ketamine shows a ton of promise as a fast-acting treatment.
Yeah.
For both depression and PTSD. And importantly, the evidence suggests that these benefits can last for a while, especially when it's combined with psychotherapy.
Yeah.
Second, it seems to work in a totally different way than traditional antidepressants, mainly by influencing the glutamate system.
Right.
And promoting neuroplasticity, that ability of the brain to form new connections.
That rewiring.
Yeah, the rewiring.
I love that.
And lastly, ketamine-assisted psychotherapy, which combines the effects of the medication with a structured therapy approach.
Right.
Seems to be really important for making sure those benefits actually last and make a real difference in people's lives.
It's really exciting to see this kind of innovation.
It is.
Especially in an area where progress has sometimes felt a little slow.
Yeah.
Especially for people who haven't found relief with the standard treatments.
Yeah, absolutely.
It's a big deal.
It really is. But as both of our main sources pointed out, while the research is very encouraging, we still need more studies. High-quality studies to really fine-tune the treatment protocols, to fully understand the long-term safety of KPAP, and to really figure out who's most likely to benefit from this approach.
Absolutely. So as we end our deep dive today,
I'm left with a really important question for you, our listener. Given these really cool findings about ketamine, how it works so fast, its potential for creating lasting change in these tough mood disorders. How do you think our understanding of these conditions and the ways we treat them, how do you think those things will evolve in the years to come?
That's a big question.
It is.
I don't know the answer, but it's certainly worth thinking about.
And what are the really crucial questions that still need answers in this rapidly advancing field?
That's something for all of us to consider, for sure.
Lots to think about.
Lots to think about.
Thanks for joining us on this deep dive.
Thanks for having me.